day everyone, I'm Dr. Kariba Akhidue, a consultant endocrinologist. Today I want to talk to you about thyroid cancers, what you need to know about thyroid cancers, how to detect it, and why early detection is very important. By the end of this video, you'll know how your thyroid gland works, what warning signs to look out for thyroid cancers, and what steps to take if you have any concerns about thyroid cancers. What is the thyroid gland? The thyroid gland is a butterfly-shaped gland on the anterior surface of your neck. It makes some hormones which include thyroxine, which is T4, and triiodothyronine, which is T3. These hormones regulate the body's metabolism. That's how your body uses energy. It also controls the body temperature, how cold or hot you feel. It also affects your heart rate, how fast or slow your heart beats. So what is thyroid cancer? Thyroid cancer occurs when the thyroid cells start to grow in an abnormal way, and they may form a lump which is called a nodule. Most of the thyroid cancers are treatable. Some of the thyroid cancers grow very slowly and are very treatable, while some may be aggressive and need urgent care. Thyroid cancers occur in about 1% of all cancers, and in Nigeria and worldwide. There are some risk factors associated with thyroid cancers, which include age. Thyroid cancers are commoner in women, but when it occurs in men, it's also very serious. We also have factors like past history of radiation to the neck, family history of thyroid disease or thyroid cancers, and history of obesity. All these are risk factors for thyroid cancers. What are the types of thyroid cancers? We have 4 main types. Papillary cancer, which is the most common type, and it's a slow-growing cancer or response to treatment. We also have follicular carcinoma, which is a slow-growing type, and it's also treatable. We also have medullary thyroid carcinoma, which occurs rarely, and it may run in families and is associated with multiple endocrine neoplasias. We also have the anaplastic type, which is rare and a very aggressive type. Most types of the thyroid cancer are usually treatable, apart from the anaplastic type that is usually aggressive. What are the symptoms of thyroid cancers? First of all, you will have a lump or swelling in the neck, and this swelling could be firm or hard, and it's usually fixed. Then you could also have an hoarse voice, changes in your voice, which is due to compression to the point laryngeal nerve or to your vocal cords. The person may also have difficulty swallowing, and if you have difficulty swallowing, then it could be due to compression of the thyroid cancer on the esophagus. You could also have difficulty in breathing, which could be due to compression of the thyroid gland on the trachea. You could also have swollen lymph nodes, what we call lymph adenopathy, in the neck, which is due to cancer spreading to the lymphatic tissues. Sometimes the lump may grow rapidly, and that should point towards the cancer. How do you make a diagnosis of thyroid cancer? First of all, you go to your doctor once you notice a lump on your neck. You go to your healthcare practitioner who will examine the neck to see if it is hard, if it's firm, if it's fixed and not mobile. You also need to do an ultrasound scan of your neck, which will show signs that may point towards cancer. And then you also do a thyroid function test to check the thyroid hormones. You also need to do a biopsy, which is called a fine needle aspiration cytology of the thyroid gland, where you take the cells of the thyroid to check under the microscope for cancer cells to confirm if there's cancer. So how do you treat thyroid cancers? First of all, once the diagnosis has been made and confirmed, you need to do surgery to remove part or most of the thyroid, all of the thyroid gland. After that, with iodine therapy, is given to destroy the leftover cancer cells, and because the thyroid makes important hormones which are very important to control the body metabolism and temperature, you need to take the thyroid hormones for life to also suppress the occurrence of the thyroid cancer. The good news about thyroid cancers is most cases are curable if found early. So it's important to go for regular checkup, especially when you notice any changes in your neck. You should see your doctors. How do you prevent thyroid cancers? By maintaining a healthy lifestyle, eating well, physical activity, and following up with your doctor. In summary, today I've talked about thyroid cancers, the risk factors, the symptoms and signs of thyroid cancers, and how to diagnose it and treat it. Remember that thyroid cancer is one of the most treatable cancers when found early, and early detection saves lives. Thank you for your time. Take care of your health. Thank you.